Hello, I'm Willard Morgan, Chewonki president. We're here on the quad on Chewonki Neck. And over the last few months, we've been preparing to reopen during this most unusual pandemic time. And one of the things we've really worked on is our Department of Health Services. And today I want to show you a little bit about what we've done for our facility, our new health center, which is in the Wallace Center. We've put in a lot of effort, time, and energy, and we've gotten great support to make sure that all of our students, faculty, staff, and campers have the support they need for their health and wellness, and I think you'll really enjoy what we've done. So, great to see you.
Hey, Willard.
Hey, how are you, Sue?
I'm good.
I just want to introduce, this is Sue Childress, our new Director of Health Services, who's joined us this year, and she's going to give us a little tour of our new health center.
So come on in. I'd love to show you around. It's a beautiful new space. And we have a doorbell now, and we're going to be entering through to the waiting room.
Oh, great.
And so we have this nice spacious waiting room here at the health center. And so we've been able to set up social distancing for when we have anybody waiting here. We have 2 bathrooms that are available, all gender bathrooms. We've got a triage room, a treatment medication room. This is the nurses station in here with Sue, wave to Sue. And then plenty of storage space to be able to keep supplies neat and orderly and easily available to the team.
And Sue, what I would say, which is really amazing, is in a typical year we'll have over 2,000 participants here on campus, whether that's in school, camp, or with the outdoor classroom. And what we really needed was a facility that can handle that scale, and it looks like that's what you have now.
Yeah, this is a very comfortable space for myself and the team to work together. We now cover 24/7 when there's students here on campus, which I believe is a big change from the past.
Well, it's so great to have you and a team with your experience here, so thanks. Do you want to show us around a little bit?
Yeah, let's do that. So Willard, here's the first room here, and we call this the triage room. So Willard, this is the triage room where we will, when we have an injured participant or a concern, they can come in here and we can talk to them about what's going on. And then we'll potentially move them into the treatment and medication room. So we'll go in there next. So here's the treatment and medication room. And we've got 2 different exam tables so that if we need to, for example, this past weekend we had a couple of sprained ankles, and so I had them sit up here. I put this up, and I was able to easily look at their ankle and assess what was going on, make sure they were okay. This is our medication cart, so when the students come down for medication, we have them wait in the waiting room, and they come in one at a time, and we log in their medication into school docs. Well, Willard, let's go into where the real action happens, in the nurses' station.
Great.
This is just great space for myself and my team to be working. We on a daily basis are in touch with physicians, with parents. Whenever a kid is injured or sick, we want to make sure everybody is notified that needs to be notified, and we keep them in that loop. I love this window that's here because we can see when someone comes in, when they ring the doorbell, we can give them a greeting and a heads up that they're here, and then go greet them through the treatment room. I have 3 full-time nurses, a part-time nurse, and I just hired a mental health coordinator. And so we've got a great team that wants to support primarily the students and participants, but also the staff if they need us. And so I'm hoping that we're seen as that resource to everyone in this community.
Well, that's great to hear, Sue, because one of the things that we're really working on is how to bring health and wellness into everything we do here. And having a facility is one part of that, but having a big enough team with the expertise is another really important part. So as you and your team get used to being here and building the program, we're really looking forward to seeing how health and wellness comes into everything we do. So thanks. This is great to hear.
Yeah, and so now I'd like to take you down the hall where we have a couple bedrooms for participants or students to stay in overnight if they need to, or if they need a break for a few hours. It's a nice space for them.
That's great.
So Willard, we have 4 rooms down this way. This first room is for the nursing staff to spend the night, and it's got its own private bathroom. And then we go down and we've got 3 rooms down here, and I'll show you one of them, that are recovery rooms, space where students and participants could spend the night if needed, or simply a few hours to rest. I want to make sure to point out a few things that makes this space very safe for our participants, students, and staff. If you'll notice, at the opening of every door, there's hand sanitizer, so that anyone entering and then leaving can sanitize their hands. We also have locks on the door, so that we address the privacy issues. And then in every room in the health center, we have air purifiers that help maintain the flow in the room and keep the air clean for us. Willard, let's go back down to the waiting room, and I can tell you a little bit more about what we're doing to address the challenges of COVID-19 that all schools in Maine and the country are having to deal with right now. So one of our big concerns is what happens if a participant has symptoms that we think could be the COVID-19 virus. We have another location, another building with rooms, separate rooms with a bathroom where we can quarantine them until we verify whether it's negative or positive. If we for sure know that it's a positive test, then we also will put them down there. So the rooms I just showed you are not for those situations, but we would deal with that a little different. We have protocols that address those situations, and we take guidance from the Department of Education here in Maine, from the CDC. We have contacts there that we work with to make sure we're doing everything we need to be doing to pay attention to the way we handle those situations.
Great. So, from my perspective, our goal was to have the facility and the staff and the supports so that we can operate school, and whatever comes our way, we're prepared. It sounds like you're feeling that that's where we stand right now.
Yeah, absolutely. I feel really good about where we are, but as I've told you before, things change almost on a daily basis, and so it's really important that we have eyes on what's happening in Maine, what's happening in our county, and we have those contacts. When we have questions, we can reach out and get some clarification as much as you can right now in this world.
Well, and what I'm really excited about is with this space we can think ahead to bringing other programs back online on campus, including Camp Chewonki and our outdoor classroom for schools, hopefully in 2021 and beyond. So thanks so much for all you're doing to make that possible.
You bet. I'm excited as well.
And thanks for your support. It's so great to have the whole Chewonki community out there, making sure that we're able to come back to the life-changing learning and nature that everyone loves.